Hello and welcome. This is Dr. Anil Joshi. Welcomes you to the series Learn Radiology with Dr. Anil Joshi series. Today's topic is adverse reaction of contrast media and its treatment. Now it is divided into part 2. Today we are going to see part 1. Now at onset I want to disclose certain things. The information we are giving through this lecture is meant only for the residents and technologists, those who are learning radiology. They are not to be implemented for the patients, but they are only meant for the knowledge. In this series, we are not giving any regimes. We are not assuring any response to the treatment or guaranteeing any success of the treatment. This is only meant for the knowledge purposes and not meant for the medical legal or implementation purposes. Most of the material we are showing in this series are from our own slide. However, if there are certain additional features we have got from the net as a free download and royalty free. Now let's start first with the adverse reaction to the contrast media and its treatment. This is part 1. And part 1 we are going to start first with the introduction. Now adverse event of the IV contrast occurs at random and are unpredictable. Therefore all the time we should be having knowledge what can happen, what can be the side effects, how it can manifest, and our full team should be properly geared up to take care and do the treatment to the patients. Full team equipments needs to be kept ready. Now fatalities have been reported after injection of both ionic as well as non-ionic contrast. So in other words, no ionic contrast is 100% safe, and we should always be prepared that if patient lands in a reaction, we must be able to identify them as fast as possible and treat them. Now majority of patients with severe reaction recover if aggressively treated. This is the best part of it, and therefore we must diagnose them early and we must treat them appropriately. Now most of the severe reactions occur within 20 minutes. That is when the patients are in the radiology department, because most of the procedure takes longer time than that, and therefore radiology staff, radiologist and radiology equipment need to be properly set up to face any events if they occur. And this skill has to be born in a full team of radiology. Now what is the classification and chemical structure of these contrast agents? These are monomeric and dimeric. So monomeric and dimeric as the first classification. Second is ionic and non-ionic. For us most important is the ionic or non-ionic type. And third is their osmolality. Whether osmolality is high or low is also needs to be considered, because many of the side reactions depend on that. So contrast should be first decided, and then its reaction, its side effects should be known. Whether it's ionic or non-ionic is a different question. Now ionic monomers, these are tri-iodinated benzene rings, that is negatively charged owing to the carboxyl group in the first position. Now ditriazolate and iothalamate are the two widely used contrast medias, that is NMNs. These have relatively high osmolality since this molecule contain 3 iodine atoms dissolved into 2 particles in solution of 3s/2, that is the ratio. Now when this ionic compound enters media, solution, blood, they dissociate into charged particle. Therefore these are called as ionic contrast medias, since they get dissociated and dissociated into charged particles once they enter. That's why they are called ionic. These ionization lead to cations and positively charged are cations and negatively charged are anions. This is the ionization effect of the contrast. For every 3 iodine molecule present in an iodine media, that is ionic media, 1 cation and 1 anion are produced when it enters into a solution or contrast media. Now, ionic dimers. Iohexate is the only commercially available ionic dimer. 2 joined tri-iodinated benzene rings containing only 1 ionizing carboxyl group is the constituency. Since the molecule contains 6 iodine atoms per 2 particles in the solution of 6s2, they are routinely low osmolar. So that is the reason why they are low osmolar. Now, non-ionic monomers. In radiology, iohexate, iopamidone and ioverisol are commonly used ionic monomers. Many hydroxyl group in these molecules permit water solubility even though they do not contain ionic carboxyl group. So they are water soluble, in other words. They show relatively low osmolality as compared to the iodine concentration. Then each ionic monomer molecule contains 3 iodine atoms, that is 1 particulate solution. That ratio comes to 3:1. Now, non-ionic dimers. Recently, non-ionic dimers such as iotron and iodixanon containing 2 non-ionic tri-iodinated benzene rings have been developed. Now, these are even lower in osmolarity, most approaching that of the plasma. So they have got osmolarity same that of the plasma. Contains 6 iodine plasma atoms for each particle, that is in the ratio of 6:1. Now let's go to the adverse reaction. Now adverse reaction, let us see first the primarily it is related to what causes adverse reaction. First is osmotoxicity. It causes pain and discomfort, vasodilatation and hypotension, and rigidification of rib. Now what will that lead to? The difficulty in respiration. So patient will complain that he is having difficulty in respiration. That is the rigidification of the ribs. Now second is chemotoxicity. This is responsible for release of vasoactive material that causes allergic like symptoms. It is believed to increase as number of carboxyl groups increases and hydroxyl groups decreases. Now then is non-ionic toxicity. Occurs when ionic substances interfere with cellular functions. The dose of the contrast is also responsible for adverse reaction, and viscosity and lipophilicity are the 2 additional things which are also responsible for contrast reactions. Now, whether osmolarity and molecular structures are responsible for adverse reaction? Yes. Ionic monomers with high osmolarity, carboxyl group and few hydroxyl group should have great ionic monomers. Conversely, non-ionic dimers should be least toxic. Unfortunately, these are very viscous. So, those which are least toxic are more viscous, and this property may limit their use. Non-ionic monomers are less viscous but more osmotoxic. So, the balance has to be known, or we have to decide accordingly, or we have to keep in mind what can happen with them. Now let's go to the iodine concentrate contrast medias. Now iodine contrast medias are, first is ionic contrast medias. Now ionic contrast medias can have anions, that is the negatively charged particles, cations, that is the positively charged particles, and more patients allergic reactions. So these are the three characteristics of the ionic contrast. They undergo ionization, they have got anions, cations, and patients are more allergic to them. Then ionic contrast media dissociates into two molecules, that is what anions and cations, as we have seen earlier. Now let us go to the second group, that is the non-ionic contrast. Now it has got less patient's reaction. Patient reaction is very low in this type of contrast. Now what are the types of reaction? First are physiological, that is non-idiosyncratic. Second are the non-physiological, that is anaphylactoid or idiosyncratic. Now let's go to the first physiological reactions. That is the first category what we have just now classified. Now, dependent on dose and concentration of the contrast, most commonly encountered include, that is the physiological reactions which we are discussing: feeling of warmth, flushings, nausea, and metallic taste. So patient will feel warmth, then he may have flushings, that is he will feel warmth and something is burning sensation, and metallic taste in the mouth. And less commonly encountered are the neurotoxicity, cardiac decompensation, arrhythmias, renal damages, and increased airway resistance. Now, non-physiological reactions. Cause is not well understood. These are independent of the dose or the concentration of the contrast. Manifestations are similar to those seen with true allergy. Antigen for contrast have not been found in the media. Now, this we have to keep in mind. One of the theory state that contrast media administration result in degranulations of the mast cells, subsequently releasing potent substances like leukotrienes, histamine, and prostaglandins. So this is one of the hypotheses stated for which causes the reaction. Now during this reaction, numerous vasoactive substances are released. These are reactions of idiosyncratic to the contrast media. One of the theories state that contrast media administration results in degranulations of the mast cells and subsequently releasing potent substances like leukotrienes, histamines, and prostaglandins. Now, multiple large studies conducted at various institutes state that incidence is low or mild to moderate in non-ionic contrast than in ionic contrast material. This has resulted in replacement of conventional non-ionic contrast because it has got no or less side effects, and whatever side effects are there, whatever small reactions or low reactions are there, are treatable. As far as possible, following category of patients should be reserved for low osmolality and non-ionic contrast media. That is, you can say as a high contrast, the high risk patient for a slightly different contrast. Patients with previous idiosyncratic reactions. So we should always use non-ionic contrast in this patient. Patient with asthma, patients having diseases like pre-existing azotemia and cardiac diseases, and patient with multiple food or medication allergies. In all these patients, as far as possible, we must use non-ionic contrast, and ionic contrast should be avoided. Correct. Now let us go to the relative contraindications. The patient with previous moderate to severe reactions of all type of idiosyncrasies, they are having more chance that this time they will have another or again the reaction. So the relative contraindication for using the dye, but sometimes the clinical indication precedes and we'll have to go ahead with all these things. That is pheochromocytomas, multiple myeloma, sickle cell disease, and poorly controlled hyperthyroidism. Now all these patients with due precautions, with good care of the post-operative care or post-procedural care, we can still use the contrast and give good results to the patient. Now what are the relative contraindications? First is patient receiving new oral anti-hyperglycemic agents, that is metformin hydrochloride or glucophages. In this patient, there is relative contraindication and a proper elicitation of history and proper arrangements to pull patient out of reaction has to be kept ready. Then any neurotoxic drugs, since these can cause fatal lactic acidosis, it should be used precautionally only when indicated and when good setup and all modalities are available to resuscitate the patient. Now what are the relative contraindication? Is glucophages must be stopped 48 hours prior to the administration. Now again we are going to the contraindications. So a contraindication, if you want to convert into indication or when we want to reduce the rate of reaction, these steps should be taken 48 hours prior to the test. It is also recommended that metformin use may be restricted 48 hours after contrast injection. That is to avoid drug interaction. Now a topic, that is the pre-medication. Corticosteroid prophylaxis is effective in reducing the incidence of contrast reactions. That's fine. A variety of regimes have been suggested, most of which are designed to reduce incidence of reactions to ionic contrast media which are not routinely used. The dose of methylprednisolone 12 to 2 hours before the administration of contrast is advised by some people. Administration of cimetidine did not reduce the number of reactions, but it does reduces to some extent vomiting or increased gastric secretions. One of the studies has evaluated use of the single dose of an antihistaminic provided to IV injection media. Sometimes AVIL is given, and according to some people, they have found out that it is fairly useful. Some radiologists routinely administer antihistaminic, that is H2 blocker, then such as then cimetidine. This is to prevent vomiting, then to prevent allergic reactions, along with H1 antihistaminic such as hydroxyl or diphenhydramine as part of pre-medication regimen. These are the different radiologists which has suggested different drugs in a different concentration with a different type of results. Patient assessment prior to injection of contrast media. To me, it is the most and first thing we should do once the patient comes to the radiology department. This is a very important for designing of the contrast. Number one, to keep the equipments ready for required, and third is to summon a helping staff that we may have this type of reaction and we may have to treat them. Then kidney function test. Then kidney function test has to be seen before, because high levels of creatinine more reliably than blood urea is one of a contraindication for going for any contrast procedure. Especially other categories include diabetes, then heart diseases, then known allergies earlier. Asthma is a relative contraindication, and for newer medicines there are not much reactions related to asthma with a non-ionic contrast. Now previous reaction history has to be known, current medication has to be known for drug interactions, then a patient is taking beta blocker, the antihypertensive medicines, then we have to record vital signs. And with all these things, I think we can reduce the reactions. There is no way we can predict which patient will have reaction and which patient will not have reaction. So what best we can do is go through the previous record, try to know what patients can have, that is anticipatory, and keep ready your supporting staff, equipments, and so also the medicine tray, resuscitation tray, and that will definitely give you more confidence to treat these patients in case if there is a reaction. With this, we are coming to a conclusion of part 1, where we have seen a theoretical aspect of contrast medias, what is non-ionic contrast, what is ionic contrast, and what it can cause. Now, I thank you for giving me your valuable time. Please note, radiology is not a race, it's a process. Be a part of this process and enjoy the knowledge. I, Dr. Anil Joshi, log off till we meet again. Again requesting you, before giving contrast, go through all the patient's record, get all the history from the patients, and try to give more safety to the patient. But unfortunately, if anything reaction occurs, be confident in treating it. Anticipating it will give you a better confidence in treating and keeping the drugs, resuscitation tray, everything ready and in time. Thank you.